We are expecting the rollout of Pfizer's coronavirus vaccine shot for kids any day now. Meg Terrell joins us right now with how doctors and parents are preparing. Good morning, Meg.
Good morning, Becky. So tomorrow, CDC's group of outside advisors meets to discuss guidance for Pfizer's vaccine, which got emergency use authorization on Friday night. After that, if the CDC director signs off, kids could start getting vaccinated very soon. So we talked with public health experts and officials about how they're preparing. First, let's look at the numbers. There's about 28 million kids in this age group, 5 to 11 in the United States. They're each going to need 2 doses of this vaccine. In terms of the supply, we're expecting about 15 million doses expected to be shipped in the first week, probably happening now after that authorization on Friday. 10 million going to states and jurisdictions, 5 million to pharmacies, then an additional 5 million per week capacity after that. Now, where are these actually going? Where will kids be able to get vaccinated? Most jurisdictions and states said they're diverting the doses to doctors' offices, 50%. 29% said to health departments, 4% to school-based clinics, and then a mixture of other places. But some states like Maine are really focusing in on schools, which is really interesting. It'll be different based on where you are. Now, how much demand is out there for the shot? Well, Kaiser Family Foundation updated its poll last week and found 30% of parents of kids this age say definitely not. 33% are in the wait and see category, and 27% say right away they want the vaccine. We talked with a couple kids and parents who are raring to go. Listen to what these little kids had to say about getting the shot.
Vaccines are very important. You should get them.
It's just a little shot for a little bit, but the sickness is gone forever.
Which is just a great description of what vaccines do, Becky. It's really interesting to hear from different families. Some are so excited and are getting it right away. Others are going to be more in the wait and see category. And we did get an update from FDA on Friday for even younger kids. It's going to be a few more months for them. Becky?
Parental concerns have increased starting since June. There have been a lot more concerns about whether they would be getting their younger kids vaccinated. That comes even from parents who have vaccinated some of their older children. What have health authorities said along those lines about what they would do, what they think about that?
Pretty universally, pediatricians and health officials are recommending kids in this age group get vaccinated for the kids themselves, for protection against what is a top 10 leading cause of deaths in this age group, but also to try to help stop the pandemic, to cut down on transmission, to help school get back to normal. And talking with a lot of these kids, they're not excited about getting the shot itself, obviously, but when they talk about what they'll be able to do, going inside, some said they want to go to Chuck E. Cheese, they're excited to get back to normal.
Is the thought that mask mandates will come down if kids get vaccinated? Is there that same sort of kind of reward system built into it?
You know, the CDC director has not been willing to say, yes, when a certain number of kids get vaccinated, we'll lift mask mandates. I think maybe they're a little bit scarred from the guidance that happened in the spring. But a lot of public health experts are calling for plans as to when we start the sort of off-ramp of masking, figuring out how we get a safe enough ecosystem around kids that we can start lifting the mask mandates in schools.
Shepard Smith here. Thanks for watching CNBC on YouTube.